Hi, I'm Kate Marie from the Slow Aging channel, and today I'm with Peter Musicans, who's a doctor with a clinic called Arda at Glebe. And Peter's been in the cosmetic industry for a long time, for about 25 years, and today we're going to get to know him a little bit better. So hi Peter, thanks for joining us and answering all our questions. How are you today?
Good, thanks.
So Peter, tell us, how did you get into the cosmetic medicine industry?
It was a chance thing. I was doing surgical training and I'd been doing that for several years through the hospitals and was getting quite tired and wanted a bit of a break from the hospital system and thought I'd do a little bit of locum work. And as it happened, one of my friends was working for, at that time, one of the pioneers in laser dermatology treating birthmarks. And they needed doctors to treat these birthmarks, and I volunteered, and I ended up really enjoying that sort of work, and never went back to finish my surgical training. So, and over the years, we set up our own practice in this area, and I must say, I think it's been a good move.
So Peter, what's your favourite piece of equipment, your favourite laser?
What I like about our practice is that we've got a variety of lasers. So with lasers, they're all very specific in the jobs that they do. But I like the fact that I can move from one to the other, and I've got a selection, I've got choices. If I had one or two, I'd be very limited, and I don't think I'd get the good results that I do with having several options.
So Peter, when you have a new client come to the clinic, do you have a set process that you take that person through?
Well, it depends on what they're coming in for. I mean, obviously we need to explain, first off I need to understand what their idea of what sort of treatments they might be having, or what their perception of range of treatments they have, and then once I understand their degree of knowledge, I can then fill in their gaps or basically re-educate them as to what sort of treatments and what sort of options they have in regards to their problems. So it is a process of listening and then filling in the patient's gaps or correcting them if they've got the wrong idea about what can be and can't be achieved.
Peter, what's your view on using skin imaging as part of a consult process?
I think they're good tools for probably research. I presume you're talking about skin imaging that can be used to analyse contours and texture and capillaries. I don't use those in our practice. It is probably a cost issue, and I'm not really sure it adds that much to the results that patients get, but I do feel that probably there is, if you've got that, it may give a certain type of patients more understanding about what results they can achieve or are getting. But as I often see, sometimes these changes may be visible under the microscope, but to you or I, with the naked eye, just talking to someone, you may not appreciate the changes. So, and sometimes I think it may be more a marketing tool, which I'm not all that in favour of anyway. I think if I'm doing some treatment, I'd like to see noticeable changes, not changes that are just visible via, detailed analysis of some sort of, highly magnified image.
Peter, what happens to our veins as we age?
Well, our veins are pretty much like the rest of our body. They're subject to degenerative process that we all see, and the veins are no different. As we get older, the collagen in the vein becomes poorer quality. It becomes less elastic, and the veins will start to become more prominent. Also, the skin around will thin, and as we age, that will make the prominent veins appear more prominent as well. And of course, if you've got you're predisposed to getting varicose veins, they'll certainly start to appear more prominent as time goes by because of these changes to the vein wall as we age.
Peter, I've got lots of spider veins, and I keep coming back and getting treatments, and they work. But what are my options for the treatment of spider veins?
You can either leave them alone if you choose, and they may not change. But the obvious treatment options will revolve around sclerotherapy, or for the spider veins, I prefer to call it microsclerotherapy. And there's also an option of laser treatment as well. With the injections, it's probably the preferred treatment. Laser is useful, but it's probably not as reliable, and there are probably more side effects with using laser to treat surface veins. So the injections are probably the most likely option for most people.
And so tell us about sclerotherapy. How does it work?
Sclerotherapy is really just a process where the veins are injected with a solution. The solution is called a sclerosant, and what sclerosant translates to is basically scar forming. So the injection is basically quite irritating to the vein wall. So once you inject that vein, the contact of the solution with the vein wall will injure that vein. And if there's sufficient injury to the vein wall, those vein walls will stick together. There'll be a fibrotic or scar reaction there, and the vein will be reabsorbed over a period of time.
So are there any side effects when we do sclerotherapy?
All treatments will have side effects. We can group them into frequent or common, and they're often immediate. You can get a little bit of pain from the injections. You can see some bruising, maybe a bit of swelling, but they're only temporary and will clear quite rapidly. Then you've got more prolonged possible potential side effects where the pigmentation or staining may take longer to resolve, clear. It could take several months. There could be some persistent redness of the area or flushing of the area where the veins have been treated, and there may also be the development of smaller, finer veins in an area. And then you've got your quite rare complications such as perhaps an allergic reaction to the solution, and deep vein thrombosis, which is fairly rare, and I don't think even treating these small ones that's been reported, but when treating some of the larger veins, it can become an issue in some people.
And how will I know whether to use sclerotherapy or other treatments like laser?
For us, it's probably still pretty easy because the evidence really points to the injections or microsclerotherapy as being still the most reliable treatment compared to laser treatment. So 99% of the patients that we see for spider veins will go ahead and have the injections done, the sclerotherapy. Then the laser will be only reserved for a small number of people.
Tell us about laser therapy for veins. How does it work?
With laser, it again, the basic aim is to injure or damage the vein wall. This time you're using a laser light, which is the laser light's applied from the outside, and it's basically selectively absorbed by the deeper blood vessel. The blood vessel gets heated to quite a high temperature, and that heat causes some thermal damage to the vein wall. If again there's sufficient damage to the vein wall, that vein will scar up and be reabsorbed over a period of time.
Are there any side effects when it comes to laser treatments on veins?
Well, with laser you've got a greater risk of side effects, basically because you're using heat. So you've got blistering may be a problem, there may be loss of skin pigment, there may be a temporary increase in skin pigmentation. You could end up with a scar tissue. So there's more potential for side effects, particularly in darker tan skinned people who are going to be less suitable for this sort of treatment.
So how will I know which particular therapy to do on my veins?
We may not be certain about whether laser or the injection is going to be the option, and often if we're not certain, we'll do a test patch with a laser. So and often people may request, because they've heard good things about laser treatments and they feel that may be the option. So that may not be quite the case. So before committing to an expensive laser treatment, we'll do a small test patch on a section of veins to help determine whether it's going to be useful or not. And that way we can then decide whether the injections, the sclerotherapy or the laser treatment is going to be a better option for the patients.
What can I do about pigmentation on my neck and chest, or DEC as it's known, décolletage? And what light therapies do you use typically?
Well, the neck and the décolletage or the upper chest, there are quite a few treatments available for the pigmentation there, but whatever treatment you have, the main concern is that the skin there is quite a lot more vulnerable to injury and side effects compared to the face. So whatever treatment that you have there, there is certainly going to be greater risk of getting side effects. Now, in our practice, we have probably 3 treatment options for or selection of treatments for the neck and chest. And they generally revolve light and laser therapy. So we'll use pigment-specific lasers, particularly where the main problem is large, discrete pigmentation marks. Then if there's a lot of fine freckles and small, lighter pigmentation, we'll go with the intense pulse light devices, or IPLs. And then if there's more textural improvement needed, as well as some lighter pigmentations, we'll look at the fractionator lasers. So we can use 1, 2 or combination of these laser treatments to help with the pigmentation in the neck and chest area.
Should I be using fractionated laser on my neck and chest?
There's no general rules, unfortunately. Each person's going to be individual. The fractional lasers are not specific pigment lasers. Their target is water, and it just happens that there is water in some of the pigment cells, so you will remove some of the pigment, but because you're only treating maybe 20% of the skin, you're only going to be removing 20% of the pigment as well. So you're going to need to be doing quite a few treatments. So as I probably mentioned before, the choice of whether the fractional laser is going to be useful will probably depend on what other features the neck and chest shows through aging. There are 3 basic changes. You've got increased redness or capillaries, you've got pigmentation marks, and you've also got thinning of the skin, which will lead more to wrinkling and creasing and textural changes. So if the predominant changes are uneven skin lines, superficial lines, creasing and pigmentation, then I'd probably look at using a fractionated laser. If there's a lot of redness, I'd probably go with an IPL.
What about my hands? I've noticed with my arms, I'm starting to get quite ropey veins. Is there anything I can do about hands and arms?
Again, it depends very much on the area. We do have treatments for prominent veins in other areas, like on the back of the hand. We can treat those. Often it may not be laser treatment, but it may be putting filler injectables or dermal stimulators to restore some of the skin thickness there to hide the veins. Again, it depends on what sort of size vein you're talking about. The deeper ones, we may use a dermal filler to hide them. If they're more superficial, red veins, we may use laser. We may even inject them if we think they're big enough to.